New York City hiring 3,000 contact tracers. Their goal to track the virus and anyone who's come in contact with it. But a recent report says it's not working. Jackie Bray is Deputy Director of NYC Test and Trace Corps. Jackie, welcome. Nice to have you here.
Thanks so much for having me.
So I'm wondering if you can set this straight for us. There were reports in the New York Times that said only 35% of residents who tested positive were contacted. Then there was a number that suggested a much higher percentage was. Set the record straight for us tonight, if you could.
Yeah, thanks so much, Scott. I appreciate the opportunity to do that. So in New York City, we have thousands of people whose sole job it is to find anyone who tests positive for COVID-19 and have a conversation with them. Really about three things. One, how they keep themselves safe. Two, how they keep their loved ones safe. And three, who they've come into close contact with over the course of their illness. That team that we have in place has reached 97% of all of the cases that we have phone numbers for. Next week, we're launching a program to go into communities and knock on people's doors for the folks that we don't have phone numbers for. And of the people that we've interviewed, 74% of them have given us names of close contacts of theirs. And I think that those numbers really show that the program is working. Obviously, we're about 3 weeks old, so we think we'll get even better than we've been. But I think that those numbers show that the program is working, that New Yorkers trust us, and that New Yorkers understand that in order to go from defense to offense and really box this virus in, we're going to have to work together. We're going to have to share information. We're going to have to take the steps that we have to take to keep each other safe.
Trust is the most important word that you just used. And you're confident that there's enough trust of a government, so to speak, agency running a program like this, tracing people and tracking people and asking them for their personal information?
Yeah, New Yorkers went through the last 110 days, 100 days together. And I think, in fact, what we saw was a tremendous amount of civil solidarity. We really banded together, did what we needed to do to keep the most vulnerable of us as safe as we could in the worst of it. And now that we're coming out of that, our message to New Yorkers is really clear. Go get tested. We want every New Yorker to get tested. When we started this program, we were testing about 10,000 people a day. Right now, we've tested over 30,000 people. Some days in the previous weeks, we're averaging about 23,000 people a day. That's climbing. New Yorkers are doing what they have to do to keep each other safe. Part of that's answering the phone, and more people are picking up for us.
So how many more people do you need to actually do the contact tracing, and what are you paying them?
So we pay between $57,000 and $65,000 a year. The people become employees of the Health and Hospitals Corporation, which is the public hospital system here in New York City. It's the largest public hospital system in the country. Right now we're only hiring another 100 or so people. We've really built the team. I think that will change as we move forward, but we feel pretty good about where we are in terms of staffing. The other thing we did that we're really proud of is we very explicitly hired people from the communities that were most impacted in New York. We went and we made sure that community-based organizations in the neighborhoods most impacted had the opportunity to send us resumes and send us people. And over 50% of our staff now are from the most impacted zip codes. And what that does is it allows us to, you said trust, it allows us to build trust and work with empathy and cultural sensitivity from the get-go.